Welcome to the Wellness Dentist Podcast. Join biological and cosmetic dentist Dr. Katie Toe as she explores holistic wellness through trending ideas, real stories, and patient experiences. This podcast will inspire you to make healthy lifestyle choices and take charge of your dental wellness. And now your host, the Wellness Dentist, Dr. Katie Toe.
Welcome to the Wellness Dentist Podcast, Oral Health for Longevity. I'm Dr. Katie Toe, and today we have a special guest. Not only that, we look up to him, we love his work, and there's lots of patients coming in because of what he's been asking them to looking for biological dentists. We have Dr. Daniel Pompa here with us today. Thank you so much for joining us.
Yeah, absolutely love being here.
Yes, and at the IVDM annual conference where all the biological dentists gathering and learning, and you are speaking to all of us tomorrow.
Yes,
so we're excited.
my first PowerPoint says, why am I the #1 referrer in all the world to biological dentists? Well, you have to stay tuned.
But yes, you are.
That's what they say. Yeah,
yes.
Exactly. So.
My office actually asking me like, do you know Dr. Pompa? Because he's referred so many patients, and we're like, no, he referred to a lot of people.
Every dentist office, like biological, they say, oh my gosh, so many people come in from you, so many people come in from you. And so it's because I believe so much illness starts here, honestly.
Yeah. And everyone that practicing this way of believing that there's more than just the symptoms and the sick care, start with the personal journey. And I know your personal journey is not easy. It's quite painful. Yes. Can you share with us what that journey is?
Well, my personal journey, so much of it was right here. I always, when I'm teaching doctors, and I have for 20 years, look for the perfect storm, meaning it's never just one thing. Typically, it's 3 stressors come together, boom, the autoimmune starts. Chronic fatigue starts, all the bizarre symptoms, whatever someone's dealing with, even cancer, it's like there's a trigger. But looking for the triggers is something that I learned coming out of my own illness, to your point. So many people start with just fatigue. That's the way it started with me, just fatigue, and then kind of moved to weird anxiety. And I was doing a lot of physical training at the time, and I was running a very busy practice. So like most people, I would just say I was doing too much, right? And stressed out, had 2 young kids at the time. But that really didn't stress me out. I mean, good marriage, good family, all that, good practice. Wasn't any of that, right? So I thought I was physically training too much. Cut back on the training, and I didn't get better. Matter of fact, I was getting worse, even, cutting back. And I even cut back some of the hours at the office. It was getting worse. The anxiety, then it kind of went to insomnia. Then it kind of went to like gut problems that I never had, like just kind of running from different foods. I ate this, I got bloated, all these weird things started happening. Then sound sensitivity, then really crazy irritability, like anger. I became someone I wasn't, right? So it just kept slipping, and it kept, complicating really. Like many people, when you have those symptoms, right? I chased my adrenals, I chased my thyroid, hormone stuff. I was like losing muscle, gaining belly fat. I mean, all weird metabolism stuff, trying to deal with that. I found Mad Hatter's disease online. Now, most dentists, I think, know what that is, but it's, people were making felt hats. They were using mercury and lead oftentimes as part of the process. So I was like, I had every symptom. I was a Mad Hatter. It's like, so I went and got a blood test like, anyone else would do, I think. And it came back normal. Matter of fact, that day I ran like $5,000 worth of blood work. All of it came back normal, which was really heartbreaking, honestly. I mean, if he would have told me you have XY disease, I'd have been like, okay, now I know what I'm up against. I'm okay with that. But even the mercury came back within normal. Here we are a year or so later. And I'm working with a very bright endocrinologist because my thyroid was, even though my blood work was normal, my thyroid was definitely malfunctioning, and there's a solid reason for that. And so he was helping me with some of those things, and he said, Dan, I think you have mercury toxicity because your body temperatures are up and then really low, and amongst some other symptoms, right? And I said, yeah, I thought so too, but I did a blood test, came back normal. He said, wrong test. That would be, if you were using mercury every day like a Mad Hatter, it would show up in the blood. But if it's a chronic exposure, it's not going to show up in the blood. So he had me challenge it out with a water-soluble chelator, challenge it out. And not only did I have odd mercury, but I had a lot of odd metals that were super high, meaning you could see my detox pathways to metal were challenged and shutting down. And so I asked the obvious, where do you think I got it? And here's where dentistry comes in. Did you have any dental work done around the time this happened? And I said, maybe. And I looked at my cycling journal, and my symptoms started right after I had 2 silver amalgam fillings, which we know contain 50% mercury, taken out. I never associated it because it was like, I just thought it was the anesthesia. I had some fatigue, and weeks go on and you never put it together. And then years go on and you definitely don't put it together. But I found out that most of that mercury was going right into my pituitary and hypothalamus. I still have that study. And I remember thinking, okay, that explains the thyroid. That explains my adrenals. That explains a lot of my hormone challenges, a lot of my symptoms. Then the next question would be, how do I get it out? How do I get it out safely, the rest of it? And then more importantly, how do I get it out of my brain where it accumulated? So that led me on a big journey. Fast forward, everything I teach today, pain to purpose, came out of that. So that was, and again, that's the fast forward version. Listen, that was 1999. I was very sick. 2001, 2, 3, 4, I started figuring things out. So
wow. Hearing your story is like a patient version story. And then here in biological dentistry, there's a lot of dentists did not have any heavy metal or any mercury or amalgam filling, and then they also get sick. Yeah. And that's how I started journey.
Well, they're vaporizing, breathing it. Yes.
People still deny that, and then we've been proven over and over that you're just brushing your teeth and chewing something hard we're causing that. So a lot of dentists also a patient of your program. Not only that they find out, oh my goodness, I'm having heavy metal toxicity with mercury, but they go into that program themselves because they need help. Yeah. Can you share with us, because a lot of our listeners also patient, we serve the public and also the professional, lots of dental professionals listen to this podcast. Can you share with us, like, how do you, what if there's someone suspecting that they have toxin, what the first thing they should do, and what do they look for help?
Well, look, I'm a really big proponent of doing the right history, asking the right questions. It can be like a fingerprint of when you look at someone's history and they have certain symptoms, it leads you to the cause. Better than really any blood test. And I find that a lot of practitioners just aren't asking the right questions. They're not putting together the history. When did you move? What home did you move into, right? Because a lot of people are also sick from mold and their environments. And, when did you get that dental work done? It's questions like that I've learned to, listen, this week, if I showed you my text, because I just lectured to a group yesterday, like 2 days ago, now time's going fast. Yeah. But I showed them 2 texts of 2 different people that someone put me on the phone with. In both cases, within 20 minutes, I asked them different questions. And I found their perfect storm, meaning both of them had the means to go anywhere, and they had. And they said, you're the first one to ask even those questions. One of them was just that. I started asking them what environments they had been in. And I was asking questions. I realized that this particular person was in a big mold exposure, unknowing. Anyways, deducing that. The other one applies to dentistry. So the other one all of a sudden had myocarditis. So I asked the question, well, did you have a COVID vaccine? And then he said no. Then I asked the question, well, did you go through COVID pretty hard? Yeah, I did. Okay, could be spike protein, right? So I'm thinking that. And then I started asking questions just regarding some dental things, knowing certain bacteria here could have driven the myocarditis. Okay, I asked questions. I said, you should probably get a cone beam. You need to do, so I gave kind of a list of things. And, he said, okay, I'm going to get the cone beam, blah, blah, blah. Yeah, I said, make sure a dentist that knows how to read it for cavitation. Okay, fast forward. I think it was 3 or 4 days later, unfortunately, this is the sad part of the story, I get a text from his wife. And she said, I won't use his name, but he was rushed to the hospital. He had a stroke. And okay, so it kind of didn't surprise me, but I felt terrible about that. My text back was, I will pray, let me know what's going on. It was probably the next morning, I got a text back. They said, well, they found a certain strain of strep, and they think that that's what caused the myocarditis in the beginning. The infection that I knew that he had. Okay, remember I said get a cone beam, because in my questioning I thought, he could have an infection, hidden infection. Either it was a root canal or where he had a tooth removed that 20 years ago, causing a cavitation. Anyway, so the doctors literally, this bacteria, that is a very common bacteria, as it turned out, to an oral bacteria that can come from, obviously, a cavitation.
Yeah. Because you ask such a detailed questions and piecing together to that, find that perfect storm. And I agree with you. When I see a patient in the practice, I would usually the first, or not many people asking them about parasite, asking about mole, asking about heavy metal testing, and so they all look at us like, why do you ask about that? Because my doctor never asked. Yet. And then you did mention something that I know a lot of people would want to ask is, you said your blood test when you were sick test normal. We know that normal is not optimal.
Exactly.
So.
Yeah, I mean, a lot of people have, they have different symptoms going on, and a lot of hormone-related symptoms. By the time your blood work actually gets out of range, and it's a pretty broad range that they use, you've had dysfunction for many, like as a thyroid as an example, my example. I had thyroid dysfunction. Now, give it another 3 years, 5 years, maybe my blood work would have went out of range. But here's the problem. Then you go to your doctor, oh, okay, your blood work is out of range. So then they give you thyroxine, they give you a thyroid medication. This is just one hormone. We could be talking about estrogen, progesterone, right? Okay, here's the medication. You take it, and maybe some things get a little bit better, right? But you go in 2 months and you go, oh, look how nice, perfect blood work now. But you're saying, yeah, but my hair's still thinning, falling out. I still have fatigue. Yeah, a little bit better, but I still have anxiety, right? So, the problem is what they didn't tell you is making your hormones better in the blood. Hormones don't work in the blood. They actually have to get in your cell to do their magic, right? So, and how do they get in your cell? They attach to receptors on the cell, and they get themselves or their message in the cell. And you feel well. Everything works great. But the problem is certain toxins and infections drive cellular inflammation, blocking the receptors. Your blood work can be made normal or look normal like mine was, and you not feel normal. So even though you make the blood look better by taking a hormone, or it's not out of range yet, it has to get in the cell. And a toxic cell will not allow those hormones in. You have hormone resistance, like insulin resistance, thyroid resistance, and toxic people have that resistance. But how many doctors are actually dealing with it? Even alternative doctors, what are they doing? They're just giving people more hormones, which can work in the beginning. It's kind of like shouting at your kids. When you shout out in the beginning, they listen, but then you shouting and they're not listening. So what do? You shout louder, and that works less and less and less and less. So, we have to get to the actual cause. And so many toxins that start right here. I mean, I just mentioned root canals. When I had a root canal right here. And when I got that out, I had no pain, no problems, looked normal on x-ray. But when I was reading that this could be house different infections, et cetera, in the microtubules, I got the root canal out. After that, that was like one of the biggest stressors on my gut. And it was amazing.
On the meridian of the gut.
Exactly. So that was like a big deal. So things happen to me to why I know what this can do to people's health. And I always say this, even if that root canal isn't what made you sick, most often you will not get better until you deal with that. And the same with the cavitation, right? That hidden infection over a wisdom tooth that was removed 25 years ago. Okay, it's like, even if it wasn't the thing that made you sick, people don't get better. Once their perfect storm is challenged, now you dentists, that take the cavitation out correctly, right? Clear that infection.
And we send it in for biopsy. Actually, the pathogen came back.
Yeah, absolutely.
Awful, right? People are like, this is crazy. I've been living with this for decades.
Absolutely. Listen, I had a guy things happen through my career that why I'm the #1 referral to a biological dentist. So this guy, he had the means again to go anywhere. And again, he did, right? And I had worked with him for probably a year or so at this point. And he still had liver pain, 21 years of liver pain, 21 years, okay? And it was still there, and it was hindering all the things we were trying to do. He had a lot of body pain that would come and go, manifest. I sent him to a biological dentist, Dr. Jerry Curatola in New York, and he took 2 big cavitations out. He texted me on the way out saying, "Is it possible that all my pain's gone?" My exact text back was, and you think it will continue to be gone? Because right now I have no liver pain and I feel like I have no knee pain, hip pain. And I said, "I don't know, we'll see." That was I don't know, we'll see.
That's right.
Well, that was 10 years ago, and he's never had pain. Yeah. I can't tell you how many people have walked out of those types of surgeries and they feel reconnected to their body. It's probably the meridian. And they just walk back into their life.
You are one of very few providers really not just educating the professional, but the public about cellular detox. But then when I first listened to your lecture as a dental professional, you brought a very great concept about upstream and downstream. And I've been using it ever since. And patient was like, "Oh, I never thought about that. The upstream and downstream." So can you share with us that wonderful concept that you make it so easy to understand why the mouth had to go first?
Yeah.
Not focus on the gut, the hormone, the upstream first.
Yeah, exactly. So let's use the mouth as the example, right? So you buy this beautiful piece of property on this gorgeous river, right? And you're very excited, but you walk down to the river and you see a lot of dead fish and a lot of dying plants and algae. And you're thinking, gosh, I'm going to fix this, right? So you do. You put all kinds of new plants in, plant life, and then you have all these fish. You restock it, right? I mean, you are absolutely putting some good money into this thing, right? And then 3 months later, you notice it's all dead again. Okay, so you're about ready to do it again, and your neighbor comes by and says, "Hey, George, you might want to save your money because you keep putting all the money into the fish and the plants and all the algae and everything to repopulate it. But 20 miles up the river is a factory putting lead and mercury into that water. So save your money." That's the point. You could put all this attention, the perfect diet, all the probiotics, right? All the things, all the stuff, repopulating. But if you have something producing up the river, a toxic wasteland, whether it's a silver amalgam filling, leaching mercury every time you drink hot coffee, chew, right? Or an infection. Worse yet, oftentimes, these cavitations, these root canals that constantly releasing these nasty anaerobic bacteria, you can never repopulate that microbiome, crushing the diversity. And if your diversity gets affected in the microbiome, that affects how your brain works, that affects your immunity. And people are down here trying to fix the gut. And again, to your point, the hormones, same thing. It's downstream to something upstream. If you're living in a moldy home, and you're trying all this and you're trying this every diet, nothing's working. You're on the best hormones, can't lose weight. It could be an upstream issue that's causing that problem.
Yeah. And the conventional practitioner, they don't ask. They just look at the blood work and say, "You're not that sick yet. We're gonna wait."
But you know what? My criticism is now, listen. I mean, regular medicine, they're great at acute care, right? Thank God we live in this country in so many ways. It's not set up to get the cause, right? It's not. But alternative, I feel like we're slipping away from cause. And what are we doing? We're running all the fancy tests, all the fancy genetic tests, and all the things that people are leaving with all their supplements, right? And, all their hormones. And yet they weren't even asked what is the home that they live in. They weren't even asked about their dental history. They weren't even asked about all of these upstream issues that they could have run into. They weren't even told, to deal with, the glyphosate that's, sprayed on all their food. They're still eating that. And they're going to an alternative practitioner.
For years.
And so it's like, what have we become then, right? We become, maybe these things have less side effects than the drugs, right? but yet we're not getting to the cause. If we're not getting to the upstream issue, then the body will never heal, right? You're just going to continue to spin your wheels. You're not going to have a lasting result. Sure, get in front of red light, I feel better. Sure, hyperbaric, man, I feel better. Sauna, I feel better. I feel better. But are you lasting better? Well, no. If you don't get to the cause, then you're not going to have a lasting result. You're not going to be better.
Yeah. I know you're the #1 referral for biological dentists in this country. And I can tell people actually in other countries that looking and watching your content and makes sense to them. What are you looking for in biological dentists when you're talking to your patient and say, you need to find one? Because I'm telling you, a very small numbers of dentists are biological dentists that capable of treating and testing and giving result.
Yeah. Well, look, it's okay with silver amalgam fillings. Most biological dentists follow something very good around the SMART protocol, right? Where they can, protect protocol.
Yes.
But when you see how they deal with root canals and cavitations, there's a kind of a separation there in biological dentistry right now, whereas there's a small group that deals with that correctly. So my team's questions really fall more around that than how they're dealing with amalgam, because they're typically
how to handle root canals and cavitation. Right. Are they giving you pathology testing? Are they doing CBCT with the radiology report? And I think that also align with, let the medical community know that we are not just making this up. Because a lot of time we get attacked and say, oh my gosh, you take this tooth that's not hurting out. And then we give them the pathology report and they're like, I want mine out. I have a medical doctor contact me after I share the pathology report with him, his mutual patient, and he called me on my phone and said, can you take my tooth out?
Yeah.
Because I'm also sick.
No. Listen, I run into dentists all the time that, have cavitation, and I'm the one educating them, right? I can, half the time, I have a very acute nose, and it came from my illness. Meaning, like, I can walk into a place and be like, flame retardant, formaldehyde, right? And when I'm speaking to people, I go, that's an oral bacteria. That's not a gut bacteria. That's an oral bacteria. Although we could argue that if they have a bad gut bacteria, they have a bad oral microbiome as well, right? But, I'm like, I just start asking questions. I don't want to offend them, right? But I'm like, you should get a cone beam. You should get a cone beam just to see. But on that question of asking, finding the right biological dentist, one of the simple things I always say is, do they do root canals in their office? Now, look, I could see a time for a root canal, a temporary tooth for a period of time, right? I'm saying, like, we have to get rid of this tooth. We have to, so temporary root canal, I could see that. But, are they doing root canals as part of the procedure that they believe? Yeah. And if the answer is yes, I'm going to tell them to look somewhere else. You're
absolutely right. I love that you mentioned that there's time, for example, when children, their tooth have not completely formed.
Exactly.
They need to keep that for the bone to continue closing. And a lot of people don't understand that the damages for their lifetime is huge when they take that tooth out early and the jaw collapsing, and now we can reverse that.
I would say do the root canal.
For emergency situation until that child, grow up, and then you have to talk about cellular detox to make sure that you're not adding more burden. We don't want to create perfect storm on our patients.
That's right. Yeah.
I don't think people can sleep at night knowing that what they're doing, what they're learning in school, are actually contributing to that storm.
That's right. Absolutely.
Right. Nobody, we take the oath like do no harm, and nobody's intentional doing that. But because we did not get the education, we did not ask a question, and we not keep that open-minded.
I never criticize a dentist because they're doing what they're taught, and you don't know what you don't know, right? But once you know, then you got to make a shift, right?
You have to do better.
You have to do better, right? The dentist who, there's a little part of that story there. So after I figured out what was going on, he was a very good friend of mine, actually, right? So, and I realized, oh my gosh, I have mercury poisoning. Here's when it started, tracking it down. This was part of my perfect storm. I brought him a nice stack of literature and, said, Derek, you need to read this. And I can use his name because he tells the story as well. You need to read this. And he, I'm sure he had all good intentions on doing it, but life gets busy, right? But it sat on his desk, and it was over a year, maybe longer, I don't know. But I got a call, and he said, I want to take you and Marilee, that's my wife, out to dinner. And I said, great. Okay. So we went out to dinner and we sat across the table and he just kind of started tearing up. He said, I want to start with an apology. I'm like, what? And he's like, I finally read what you said and I apologize I didn't do it sooner because I was part of your whole demise, right? And it's like, and he was like, thank you for not hating me. I'm like, well, no, you didn't know. Like, what did you know, right? Anyway, he changed his whole practice.
Yeah.
So
most people have a hard time unlearn what they learn to learn the right information.
Maybe some people have trouble with the past, meaning, well, wait a minute. If I believe that root canals are bad, if I believe that silver fillings are bad, look how many I've done. I don't think you can look at it that way. It's like, I think we have to move from where we are.
That's right.
Right? It's like, and say, okay, I think it's worse going on justifying something. And that's what human does, right? They justify, they'll hang on to what the ADA says as an example, right? Just to feel better about themselves, and I'm not being critical or harsh. That's human behavior, I think, right?
Yeah. And everyone on the show always will ask to share what their 3 non-negotiable daily wellness practice, because the show is about the wellness and longevity. And so we want to know, everyone very curious, Dr. Pompa has been helping so many people, but what he's doing in his daily life that consider wellness practices that non-negotiable for you.
By the way, I just finished one of my detox cycles.
Okay.
I mean, here I am, how many years later, right? I'm 60 years old. I got sick in 1999. I was like, what, 32, 30. Anyways, and so I still do cycles periodically. Number one, genetically, I definitely don't get rid of heavy metals very well, okay? But they bioaccumulate in everybody, so don't use genetics ever as an excuse. But I still do cycles. And it's like, my brain phase is what I believe God gave me. It's freed many people, not just me, of how to get this inorganic mercury out of the brain. I still do cycles. I never will not. Matter of fact, the exposure today is even worse. Do you realize they're putting aluminum in jet fuel to make it more efficient, right? It's part of the new formula, right? But what happens, it's falling literally out of the sky. People think it's from chemtrails. No, it's right from every jet fuel, okay? And not to mention the aluminum that's in a lot of pesticides, herbicides. So the aluminum exposure today, on top of the fact you're already challenged with your mother's heavy metals. Remember, your first exposure of mercury happens in utero.
That's right.
The Drash study, the
That's
number.
my children.
That's
My
right.
children. Yeah.
Ours too. The number of silver fillings in mom's mouth is proportional to how much they found in the baby's brains on autopsy. So now you start hitting it with the aluminum. You hit them with the lead. All of that accumulation is in your tissue. So everybody needs to detox it out. But, to answer your question, I still do my detox.
So
okay.
detox is a part of life for you.
That's all the time. Never will not be. Number two, I fast periodically. I do at least 1 or 2 5-day fasts a year, either water or a partial fast. Typically, I just like pure water fasting. It's easier for me than partial fasting. So I do that always. I rotate my diet. Right now I'm in ketosis, which isn't a diet. Ketosis is a metabolic state, but I rotate it. And then maybe I'll go to a higher healthy carbohydrate diet after this. That's what I was just on. So I diet rotate because it creates more diversity in the microbiome. It creates health. I feast famine. So there's days a week where I don't eat for a day, or maybe I eat 1 meal. And then there's days that I eat 3 meals. And so I vary my diet weekly, monthly, seasonally. So that's something I always do as well.
Yes. What is the third thing?
Oh, I thought that was 3. Fasting strategies, diet strategies.
Yeah,
I'll give you another one.
Yes.
Forgot.
It doesn't have to be. It doesn't have to be. I would say about the lifestyle. It could be.
Well, I'm going to tell you the most important. I
Yes.
start every day, and this does apply to my health, trust me. I start every day in prayer. I start every day reading my Bible, and gratitude is shown. Absolutely shown to change who we are physically, spiritually, and emotionally. And I start every day right there. And
Shift your state.
yeah, and that is a non-negotiable. And that was your question. Non-negotiable. That is the most important thing to me.
That's so beautiful. I feel like I don't have to tell people where to find you. because they know where to find you, because you actually sharing so much information. And a lot of dentists actually reach out to me and say, I listened to this reel on Instagram. Is it true? And I'm like, absolutely. Here's more information for you. Go to the ibdm.org and you will find information about biological dentistry.
Yeah.
Because we think everyone know everything. No, they're not exposed to it and they don't feel safe to ask questions.
What I should do is I should tag you in those things. I'll have my team, your organization, because it's important that people know where to go.
That's right.
Right? And how to, I think that's really, really important. So I'm going to do more. I love doing videos on dentistry. I do.
You are natural. You are so good because your compassions show through, because your pain become now the purpose.
Yeah.
And so we can totally see that. And thank you again I know you're super busy. You've been traveling a whole lot, lecturing a whole lot, and helping everyone here. And so just to remind you, you're not just helping the public, you're also helping a lot of dental professionals. Because I know so many people in my friend group that going through this program right now. She actually I'm coming to this meeting because I'm the patient.
Yeah. Well, I think like everyone should be. It's in particular dentistry. Yes.
You will see that ship in the room tomorrow.
Yes.
You will see that ship in the room tomorrow.
Cool.
I think after they listen, because I had that ship when I listened to you in person, and I'm like, oh my gosh, everyone had to explain to a patient like this.
Yes, exactly.
So thank you again. You can definitely find Dr. Pompa at Dr. Pompa on social.
Yep. Yeah. Just DrPompa.
And your program, how do they find information about your program?
That's pompaprogram.com. And there's some free classes they can see there too. So pompaprogram.com.
So thank you so much.
You're welcome.
Yes. And please stay tuned and make sure that you follow Dr. Pompa and share his program and send us your questions. See you next episode.